the reason why we are here was largely to do inspection to see what is the progress in the preparations for the surge as it's coming into Gauteng. So firstly, we wanted to get a briefing from the management, and we're very pleased with the briefing from the CEO, the management, the clinicians, the unions. There's a very encouraging spirit of working together, which is very, very important, because you need all the different strands to be able to pull together so that they can deliver a very strong program to fight against COVID-19. So that's the one area that I was quite impressed with. And secondly, that they don't have problems of PPEs, and that they don't have problems of communication. They can talk through each other to sort out whatever the problems are. The second issue was to have a sense of how the construction of some of the structures is going. The CEO did give us a presentation to indicate that in the past few weeks they've seen a rapid turnaround time in terms of the work that's being done. This is in relation to the work we've put together of emergency intervention teams, where national and provincial offices are going into the areas and make sure that where there's a pressure on beds, we must provide more beds. Now, the third one was obviously to welcome the nurses that we have recruited, and these are paid for by the national department. We're actually coming to reinforce, and we also are aware that the provincial government is going through databases to employ more and more staff. So we're attending to issues of how the institutions are coping. We're attending to the issues of the rollout of infrastructure, the provision of beds, and provision of oxygen and other equipment. We are also attending to the issue of the shortages of staff. So those are the three issues that we came to deal with here. And as I was discussing with the management, the clinicians, it's very, very important that they are supervising and overseeing the plans that are coming in, so that the plans they ensure that the functionality is in keeping with their system and the way that the patient flow is going to be happening here. So this site here is one of those. So inside here you have seen a number of marquees, and this is what's happening. Now we've been attending to this concern about the shortages of beds. Now sometimes when people say they've been turned away from hospital, it's because the doctors felt it was not necessary to admit the person. But where there's a need for admission, the people will be admitted. But because we are seeing the numbers increasing, we want to make sure that the hospitals are moving ahead. The blockage is at the entry level, where people come in and are under investigation, waiting for their results and being assessed as to whether they are COVID positive or negative. The hospital has been well separated so that there are COVID positive areas which are not linked to the rest of the hospital. This is important because the system of running those wards must reduce the level of infection, the PPEs and so on must be adequate, and also the patients must not be mixed. Those who have got other problems must be kept somewhere else. Those who have got COVID must be kept separately. We're very impressed. I've gone around, I've spoken to the staff. Everyone is confident to deal with the issues. Now, the issue that is important now is that this is not where everything starts and ends. Things start at the community level. Quarantine, testing, people who are contacts and people who have been found to be positive need to be taken for isolation, either self-isolation if they are asymptomatic, or they must go to quarantine. We do have a lot of beds which are available, and we are actually opening up those beds because they need to be able to take the contacts that need to be put into those places. So it's difficult to have a stop-start arrangement where if we don't have beds, if we don't have patients today, excuse me, we then close off. The hotels have to be ready with the service because we no longer know how many numbers we're going to get. Once you start having 20, 30, 40,000 people who are positive, the numbers are going to be increased on the quarantine side. So those beds are going to be used. The fact that they were not being used is because we need to be ready. We've got more beds here that are not being used. We can't say, well, there are no people yet, because when they come, there will be no warning. So that is the issue. The beds are ready to be used. We want to make sure that our system of tracking and tracing is on course, and that the beds are available to allocate to the people who are being sent for quarantine. And here, we don't have, the beds are not full, but we need to make sure that the absorption is improved with more beds so that people can go into the number of wards. So everywhere in Gauteng, the beds are not full. but it's the blockage at the entry point that we want to relieve, and we are actually happy that it's going on well.
All right, Asif Osterman from SABC News. Yesterday we had the World Health Organization coming out saying that reopening of schools should be done responsibly, safely, in a context of low community transmission. Now, we've seen the numbers rising in South Africa, but here we are still opening the schools. So can you speak to that? It's quite a popular clip that's been doing the rounds on social media. I think it's Dr. Mike something from the World Health Organization that was speaking on this, that countries need to be responsible, not politicize the reopening of schools. It should happen in cases of low community transmission. If you can speak to that, please.
Yes, certainly. We have been engaging with the WHO. Our conditions in different countries are not the same. Ideally, we should open the schools, open the workplaces when the transmission is low. In our case, we have got a crisis on the one side, in the sense that we need to begin to have economic activities to deal with the problems of the food insecurity, the issues of income insecurity, the high unemployment. So in balancing all of that, we have now got to get our communities to learn to coexist with the virus. We have actually got our ministerial advisory committees, all the pediatricians as well as the other scientists who look after the children. We have asked them to say, give us advice. What do we do with the schools? They have said, no, we can open the schools. And of course, there are these protocols that we put in place. And so whilst we understand what the WHO has said, our approach to the schools is based also on some of the precautionary measures that need to be taken as you go into the schools. It is because we know that we are going to be coexisting with the virus for the rest of the year and up to next year. So we need to begin to adjust to that kind of life with the virus. The precautions that we have got to do with the issues of getting the community to change behavior and ensure that the use of masks for everybody who's outdoors, who gets into any other building, for ensuring that they had sanitizers, hand washing and distancing, all of those are put into place. So it's a balancing act that we have to work on, but we're very cautious that if we think that there's any risk, we have to mitigate such a risk.